So please do take part. That's what you can all do as citizens and to just help the nation in this drug overdose epidemic. Hi, I'm Dr. Abenaa Jones, and I'm the Ann Atherton Hertzler Early Career Professor in Health and Human Development at Penn State University. So Save a Life Day is a national initiative to distribute harm reduction tools like naloxone and overdose prevention across the U.S. I believe, last year was the first year, and there was about 84,000 units of naloxone distributed. I would encourage everybody to take part in it. Look at your local community, whoever is hosting anything related to that, and who's giving out naloxone. I have naloxone. I have it in my car. Again, you never know what situation you might stumble upon. Even if you don't use drugs or hang around people or know people who use drugs, just walking on the streets could be a day in which you encounter something that you can actually help. And think about just naloxone is you can actually save a life. And that's one of the most meaningful things you can do in this life. Literally save another person's life and give them another opportunity to have a new day and a new beginning. Probably the quickest and easiest way is just look up any community-based organizations that help people who use drugs. There's always some in every community. Those places would have naloxone for free generally, and they will also be able to train you on that. Any kind of public health organization in your community will likely have naloxone and will likely be able to show you how to use it. So basically, it's an opioid overdose reversal drugs. So once you administer, usually there's a spray one, you can spray it in people's noses. Basically, it works by just reversing the effects, right? So people typically are in a depressed state where it's like their breathing is lowered and suppressed, but it's able to reverse that, and then they're able to breathe again. They're able to, be able to come back into consciousness.